Good evening, and thank you for joining us for the March 12th Board of Directors meeting for the Escambia Children's Trust. Please turn off all cell phones or place them on silent mode for the duration of the meeting. We have public comment forms on the table to the left of the podium. If anyone wishes to make public comment, please complete the form and turn it in to Ms. Alma. We will now begin with roll call.
Ms. Woods?
Present.
Mr. Williams?
Here.
Mr. Peden?
Here.
Dr. Northup?
Here.
Mr. Leonard?
Here.
Ms. Kane?
Here.
Commissioner May? Ms. White?
Here.
Judge Harris?
Here.
Thank you.
Thank you. And now for the Pledge of Allegiance. Judge Harris, would you please lead us?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. If everyone has had time to review the agenda, may I get a motion to approve?
So moved.
Second.
Any discussion? All in favor?
Aye.
Now we're moving on to the approval of the minutes. The staff recommends the board approve the minutes from February 13th, 2024 regular board meeting as presented. May I get a motion?
So moved.
Second. I'm sorry.
Any discussion? All in favor?
Aye.
It is approved. Now the treasurer's report. Mr. Peden?
Thank you, Madam Chair. The Finance Committee met about a week ago and went over the financial statements and looked at our budget. As you can see, the financial highlights in your packet. There are no unusual or abnormal transactions conducted during the month, and we'd be happy to entertain any questions about the financial statement. If not, with no objections, the financial statement will be filed for audit.
Thank you. Moving on to operations, Ms. Keenan, I understand you have a recommendation to share that's already been presented to personnel.
Yes. So unfortunately, we're going to be, for personnel, we're going to need to be hiring another director of operations. Ms. Krupa has been wonderful and stayed with me to keep me up to speed, but her last day with us is going to be March 31st. So we have gone together and looked through her job description for what we actually need related to my skill set and what I bring to the table and what we really need going forward now that we have contracts in place and providers to work with. So we did strike 3 of the responsibilities from that job description that I believe are more executive director-led responsibilities. And so we would like for the new job description to be approved and to move forward with posting that and hopefully getting in our next team member who won't fill the shoes but will bring a whole new set.
I ask when Dr. Krupa's last day will be,
March 31st.
so that will be the end of this month.
Yes, sir.
We will not have another board meeting prior to that time, is that correct?
That's correct.
So with that in mind, would like to extend my personal appreciation and recognition and thanks. I was just reminiscing with her a few moments ago about the meeting that she and I had in the recruitment and discussion of this organization a while ago, and how much I've appreciated and benefited from your tutelage and leadership and continued support of the organization. Thank you very much.
And I apologize, I skipped around. I guess I'm trying to get out of here to make it to this baseball game.
It's all right. I knew what you were going to ask.
Yes, sorry about that. So I just wanted to share that I attended Children's Week. Is that what we got, right? Oh,
I move approval of the job description change.
sorry.
Second.
Any discussion? All in favor?
Aye.
This move. I apologize for skipping around. So I guess we'll jump back to the Children's Week. Yes, ma'am. So I attended Children's Week, and I know at our meetings with personnel, I talked about how I thought it was really important. There were other trusts at that Children's Week event advocating and networking and talking to other programs, and it's just an example of like community outreach and how other trusts across the state are really getting the word out and, you know, talking about what we do. So there's just like a small little video that I just wanted to share with everybody about like examples of what our trust can be out there doing. So Ms. Alma's going to share that with us.
That Florida's children and families really have to be the top priority in everything that we do.
Absolutely. Now, Children's Week, it kicks off this Sunday, the 25th. There are events and activities until March 1st. Two of the big events next Monday night, the Advocacy Dinner, that's over 600 people, and then Tuesday, February 27th, that's Children's Day at the Capitol. That's an incredible experience for kids. Let's talk about both of those events.
Absolutely. So I always say that the Advocacy Dinner is my favorite night of the year. It's when over 600 people get together, and it's the people that you work alongside all year long, working on the systems, working on the policies, and we all get in the room together and just have a great networking event, celebrating what's happened in the last year, talking about new commitments that are coming. And during the evening, we also celebrate 3 individuals: a Youth Award winner, an Impact Advocate Award winner, and a Child's Advocate Award winner. These are 3 individuals, youth level, a mid-career level, and a legacy level, who've just really done a lot of impact and positive change for children and families in Florida.
Children's Day, what about that?
So with Children's Day, this happens on Tuesday at the Capitol. It starts out that morning with a press conference, and this press conference is attended by all the agency heads who help support children and families in Florida, as well as incoming leadership from the House and the Senate. We also have our award winners there to participate as well, and again, just continuing to stress the message of our commitment to Florida and commitment to the children and families in Florida. After the press conference, we have all kinds of fun-filled events for children. There are interactive games. There is a storybook village where they may see some stories come to life, but also there are celebrity reading stages that will include some of our state agency heads, local college athletes, and many others as part of those celebrity readers. There is also a lot of different events and performances happening that day with children and youth, again, just to come together and show children and families that we are committed to them and their future.
Such a great day for the kids. And lastly, Erin, why is this event so important, and what do you hope that the impact will be for children in Florida?
Being honest, this work is sometimes really hard. There are a lot of people who work tirelessly to get the work done, to do what's best for children and families in Florida. And this week is just a reminder that everything we do has to keep that message in and keep a commitment going that all children and children and their families should be successful, and that all children, as you mentioned, should be healthy, ready to learn, and be able to achieve their full potential. And honestly, just a reminder that there's too much at stake for us to give up that commitment.
There sure is. Thank you so much for being here, Erin. Children's Week, it kicks off this Sunday. For a full list of events and activities, or to register to attend with your students or your little ones, all you have to do is go to childrensweek.org. We'll be right back.
Thank you, Ms. Alma. And this is another, but what I thought was also important was the CEO and president of the Children's Trust in Miami was actually awarded the Impact Award on that Monday, which is a huge award and recognition with, you know, about the work that he's doing in the community down there. So if you guys ever, you know, if you have time and want to look that up, I thought, you know, that really highlighted that how much that impact can be on our community. So I know who I'll be nominating next year. So we are moving on to public comment. Before we move on to the business portion, do we have any public comments? No public comment. Now we are moving to programs. Under programs, we have a recommendation from Finance Committee regarding a 2-year contract renewal. Mr. Peters?
Yes, Madam Chair. You'll see in your packet the 2-year contract renewal for legal services in Northwest Florida. In our committee, we had a robust talk about this and what impact it's making in our community, and they are ramping up, and I think that moving forward that they are going to continue to do a good job on behalf of this trust and the grant that they've received. And if there's any questions, if not, I entertain a motion for approval.
Motion to approve the contract.
Second.
Do we have any discussion? No discussion. All in favor?
Aye.
Any opposed? It passes.
Thank you, Madam Chair.
And we now have a special presentation from Ms. Krupa.
Yes, thank you. I actually am ceding the floor to Mary Ann Bickerstaff and her team at the Art Gateway for a special presentation about Help Me Grow Escambia. You all have the brochure that Mary Ann passed out. Mary Ann's the longtime director of the Pearl Nelson Child Development Center at the Art Gateway and received the bid to start Help Me Grow Escambia, which she kicked off on July 1st. So she's going to tell us how the first 9 months have gone.
Good evening. Thank you to the Trust staff for inviting us here tonight. We're really excited to be here, and joining me this evening is Teresa Zerkowski, our Marketing and Communications Specialist with Help Me Grow Escambia, and Andrea Hamilton, our Early Intervention Manager, who supervises both our developmental intervention with Pearl Nelson Center and our Help Me Grow Escambia developmental intervention, as well as our care coordination with Help Me Grow. We're excited to share with you the progress that we've made towards the implementing of this comprehensive early identification and intervention program for the families of young children in Escambia County. Our first several months focused on recruitment and hiring of 7 positions designed to meet the 4 core components of Help Me Grow, along with the comprehensive training from both Help Me Grow Florida and Help Me Grow National on how to implement the model with fidelity. With the hiring of our marketing and communications specialists in January, we have quickly picked up the pace on implementation of the program and expanded services. Help Me Grow is dedicated to promoting early identification of developmental, behavioral, and educational concerns in children, serving as a bridge to essential community resources at no cost to parents or caregivers. The Help Me Grow model has 4 core components. Those are care coordination, family and community outreach, child health care provider outreach, and data collection and analysis, which is used to inform the future work. I'd like to add that all the photos you see here this evening are actually our staff and our children receiving the Help Me Grow developmental intervention. Historically, Help Me Grow Florida has a 94% success rate in connecting families to the services they need. This is greatly influenced by the dedicated follow-up of care coordination. Families can be connected to Help Me Grow Escambia's care coordinator through a warm transfer call when they call United Way's 211 information referral line, through our dedicated phone line that we have specific to our care coordinator, through our webpage, which is in its final stages of being in a final status, and also through February, just giving you an update on what's happened with that care coordination, we have had 37 intakes, 8 for referrals for basic needs that have been successfully connected to community resources, 1 family that needed to be connected to behavioral services, and 16 who have been enrolled in our Help Me Grow Escambia developmental intervention services, who are children who do not qualify for early steps but are still showing developmental delays and need that intervention. We still have 12 who are actively in process with our care coordinator, working through the process of identifying what their specific needs are and how we can help them get connected. Although I referenced the 4 core services of Help Me Grow Escambia is unique in regards to providing the developmental intervention services. Help Me Grow Escambia is the only affiliate in Florida who has dedicated funding, thanks to you all, to address service gaps that were identified in the work that was completed by the Achieve Escambia Kindergarten Readiness Collective Action Network over the past several years. While we know that 13 to 15% of individuals have an intellectual or developmental disability, the data shows that we have only been finding 3 to 5% of our infants and toddlers who could qualify for early intervention services. And it's so important because these are the most critical years in a child's life when we have that extensive brain development that's taking place. While over the years, eligibility criteria for early steps has also narrowed, this leaves many children with developmental delays unserved and showing up at kindergarten not being ready. Based upon the information, 3 of our 7 positions that you're funding are infant toddler developmental specialist positions to provide that developmental intervention for these children. This intervention is so critical because the research demonstrates that 1 out of 3 children who receive early intervention will not require special education when they enter school. We have had 16 children enrolled in Help Me Grow developmental intervention in the past 2 months, and another 2 this week. And just last week, we received a call from a child care director who's referring 10 children that she believes need services immediately. Some of our early successes relate to, because we already, as Pearl Nelson Center, we're a provider of developmental pediatric physical, occupational, and speech therapy services, referrals come into my early intervention billing specialist, and she might see a note on there that says, did not qualify early steps. So she's reaching out to those families because in our community, right now I have 97 children on my wait list for speech therapy, just to get in the evaluation and placement process. That's similar throughout our community. We have a critical shortage of our allied health professionals. So what she's able to do is reach out to that family and say, we received your referral for a speech therapy evaluation or physical or occupational therapy. But we have another program called Help Me Grow, and we could connect you with that immediately. We could use your results from your early steps evaluation, and if you qualify, we can get those services started within a week. And so that's where these 16 have come from primarily. Some of our outreach events, but the vast majority have been from children who would otherwise be waiting for services. Another success for us has been one particular family that we've worked with. One of our agreements in the community is that we provide on-site speech therapy at Corey Station's Child Development Center on base. And so we've had our speech therapist seeing a child there where she's really only had interaction with his child care teachers. They all suspect that this child is on the autism spectrum, but have not been able to get really connected with the mother on moving forward with child find process. They were able to offer her our developmental intervention program, and because that developmental specialist was working closely with the mother, she has now made that connection to say, okay, I'll accept that referral to Child Find and is scheduled this next week with an appointment. So that her child now, the reason I say he's a success is that he's going to be connected to the services that he needs, which otherwise would not have taken place. And then lastly, a few weeks ago, a couple of colleagues of mine contacted me, and I reached out to a mom who had a Facebook post where she shared about her 2 children that she had adopted. Both of them had been prenatally exposed to opiates. The younger sibling, 13 months old, a nurse told the mom that this is the worst case of prenatal exposure to opiates she had ever seen. She was tested by Early Steps in February and found to be 7 months behind in communication skills and 4 months behind in her motor skills. But what the mother's post stated was, but the state of Florida and insurance say we have to let her fall further behind before they will step in to help. They also have a 2.5-year-old that they adopted who's been expelled from 2 to 3 child care centers. And the day I was speaking to the mom, she was worried that her nanny was going to quit because of his behavioral needs. I asked her, could she send me their Early Steps eligibility? He had been evaluated by Early Steps twice and not qualified. I asked her, could she send me those evaluations? I got them within the hour and was able to make both children eligible for our developmental intervention services. And last week, there was this post that I'm share with you of the mom's feedback. Escambia County property taxpayers, I present to you tax dollars being put to good use. Both kiddos finally qualified for a program that will not only offer additional resources, but brings those resources directly into our home. Lost my mouse. Let's see. Got it. Community outreach stands as a cornerstone of Help Me Grow Escambia's mission. By nurturing relationships with local service providers, we not only expand our network, but also ensure seamless access to resources for the families who are in need. This active community presence not only encourages support and participation, but also facilitates the continuous gathering of data and information that's essential for our early childhood resource directory updates. We've participated in 4 outreach events that target families and caregivers to impact 722 individuals. We've done 20 that target service and agency providers that have influenced 244 individuals, and 3 that have targeted healthcare professionals or pediatricians that have impacted 7 individuals. In Century, we have collaborated both with Parent University and the newly formed Community Council, they put Unity all in caps, to begin screenings on-site at Pensacola State College. They're also, Sparky, if you've ever met her at Pensacola State College, is providing us a space where we will be able to do parent and child play groups as well. She told me that this Christmas she finally got a cap from one of the residents in Century that said Black Cats on it, so she knows she's been accepted. And so we're going to be making connections through Sparky to try and build the trust of families in that community so that we too will someday earn that Black Cat hat. Also, in partnership with Parent University, Early Learning Coalition, and the Early Childhood Court, we will join together to participate in training on a nationally recognized model developed by Strengthening Families called Parent Cafe. This is a research-informed approach to increase family strengths, enhance child development, and reduce the likelihood of child abuse and neglect. It's based upon building 5 protective factors that are parental resilience, social connections, knowledge on parenting and child development, concrete support in times of need, and social and emotional competence of children. As the parent facilitators, as I mentioned, it's parents and providers who are receive this training to carry it out. And as the parent facilitators take on more leadership, first they're like table leaders, and then they become leaders of the actual meetings. The providers remove themselves, and so it becomes a parent support system by parents for parents. Our upcoming initiatives highlight our commitment to growth, inclusivity, and community collaboration. This Friday, we are sponsoring a diversity training for community partners titled Our Identities and Our Work. We have 2 professors who will be presenting on that at Green Hut Auditorium at Sacred Heart Hospital, where they will be helping us to look at what we take as far as our background and culture and how we interact with the families in our community. We're going to be hiring our 3rd developmental specialist in the next week to expand our developmental intervention capacity. We're implementing the Autism Diagnostic Clinic for prompt diagnosis. And I need to move my slide forward. We're attending the Help Me Grow state meeting to connect with affiliates and learn from them. We're collaborating with the Community Council in Century every other month to be there present and doing developmental screenings. We're joining Community Health Northwest Florida's mobile health unit at Addicts Court and Oakwood Terrace to do developmental screenings on site with their mobile health unit is present. We're meeting with the Community Health Northwest Florida individual pediatric offices. Their pediatric director, Dr. Callwetter, has put out the word that they are to meet with us whenever we want. So we're excited that they are a large provider of our medical practices and for children in our community. And so we're very excited about that partnership. We also have Florida Blue is going to promote Help Me Grow in their office and in their parenting classes. We've become a community partner for the Junior League Diaper Program and the Diaper Bank and be able to get that distributed to families. We've become a community partner with DCF for economic self-sufficiency so that families are on site with us. We can help them get connected to those services. And we have about 5 events called Books, Balls, and Blocks. That's something that's an initiative of Help Me Grow where you create 5 play stations at community events. And while the children, and you're engaging the parents and children in play, you then have the opportunity to complete those developmental screenings and help them get connected to resources as well. So we're going to be at Be My Neighbor Day this Saturday, the Levin Way Fest, the Building Brains Ballpark Bash, Art Gateways Over the Edge event in April, and also our partnering with Echo Life Church to use the parking lot there to do a Touch a Truck event, which is we'll have all kinds of trucks that little kids like to see, from your fire trucks to your garbage trucks to anything you can imagine. And we picked there and asked for their partnership because it's located right across the street from Pensacola Village, which is certainly one of our target areas of where we want to influence families. We hope you'll join us in our efforts to spread the word about Help Me Grow Escambia. Follow us on Facebook and Instagram, and let us know of connections in your areas of Escambia County where we can establish more partnerships to help more children reach their maximum potential. That's all I have, and open to your questions.
No questions, but I love the presentation, and that information was very touching, and I'm happy that we're able to, really reach those families that are in need.
It's really thrilling. It was very challenging to have those setbacks of trying to recruit staff, which was my biggest fear when we put in the application. But it was worth the wait because we have a really wonderful quality staff in place now.
Yeah, I had a statement. You had mentioned that you're serving about 3%, 3 to 4%, but the need is 13%. Why? I mean, why is that?
There's the lack of identification, needing to find children in child care centers, in pediatrician offices. There's just a delay. Even the children, several of the children that the little boy I talked about getting in connected to Child Find, we got him at 2 years, 9 months. We have so many children. We still have pediatricians that will say, well, let's see at the next checkup. Sometimes that's 6 months later, and in these critical years of brain development, that is way too long.
So the referrals, who refers? Any and everybody?
Anybody. A parent can self-refer. You could refer on behalf of someone as long as they know that you're making that referral, and we'll call them and say, Mr. Williams said that you had asked that we give you a call. With 211, we will either have warm transfers, or if the person doesn't want to be connected right then, they will send us a spreadsheet at the end of the day and have us call directly back to those individuals.
And you work closely with Early Steps? Are y'all like
Yes.
hand in hand?
Matter of fact, some of our referrals recently, they, because their corporate rules cannot establish a referral process with us, but they are sharing information with families to make them aware that when they don't qualify but still have needs, that this service is out there. Thank you.
Madam Chair. So the referrals from the pediatricians, does it come from Community Health, Health and Hope, or Pensacola Pediatrics? Where are those referrals coming from?
We get a lot of referrals from Community Health Northwest Florida, very significant, also Pensacola Pediatrics. Two of our physician champions that I kind of missed on my notes, Dr. Jody Picasso and Dr. Carol Andrews, are actually going to be partnering with us as physician champions to the private practices, and they are partnering with us to actually implement our autism diagnostic clinic that will be starting in April.
How are we identifying those adolescents who are most at risk? I mean, particularly what you just said. I mean, I know you're at
Right
ECHO,
now,
but how are we doing Pensacola Village? How are we doing Oakwood Terrace? How are we doing Addis Court? How are we
Right.
targeting those kids?
So we are going with the mobile health unit to Addis Court and Oakwood Terrace, and tomorrow to Addis Court, and next month into
It's
Oakwood
your
Terrace.
mobile health unit, or is
It's Community Health Northwest Florida has invited us to go along with them. And so some of the things we're going to be doing is looking at using some of the resources. One of the things I've learned from Parent University is these families really appreciate getting gift cards, and so we'll be doing raffles and those kinds of things to help encourage that. We'll also visited our neighbors in Panama City, and they have purchased early childhood kits. And so when a family comes and has a screening, they have this little kit of materials that they give that the family takes home with them and can actually do something immediately with their child.
So, and so I would assume, that you're going to community centers like Boys and Girls Club, Fricker Center, Cobb Center, and those.
Yeah, that's the focus. Our family and community outreach specialist, she's getting out there. And Mr. May, if you have any names you want to give me, I'm certainly willing to take those and happy
Andrea
to
knows me
reach
well.
out.
I'll give you names.
We want to be out there. We want to find what families need from us and be able to be present. If this child care center has 10 children certainly that are definitely in need of this intervention, we'll be there 2 half days a week because that's enough. And the other beauty of building this a program without the government oversight is that some of these children where typically we can go 1 hour once a week, these children that are being referred to us at 2 years, 9 months, we're seeing 2 or 3 times a week. We're getting them into a Mommy and Me play group, and we're able to go to some appointments with them as well if that's needed to help the parents get through the process.
No, absolutely. I appreciate you doing it. I guess my question is, we've been in this for a while. What type of data have you been able to collect about our performance as it relates particularly to those children who are most at risk? And how do you make that connectivity? I mean, I guess for me, I'm trying to say, how am I making that connectivity to those kids at Montclair, CA Wise, Ansley, Century, to those kids who are most at risk? I mean, how are we measuring it?
What we will do is, when we first begin working with a child, we do the Patel Developmental Inventory assessment to see where their skill levels are. Then we create a developmental intervention plan, similar to what we have had with our children under Early Steps, where we have long-term and short-term goals based upon doing kind of a family needs assessment with the family, going throughout their activities of the day and where are they having the most challenges, and developing that plan to help them and the things that the parents are having the greatest challenges with. And so we will then gather progress on that every 3 to 6 months.
So you get the referrals, you have a data point of where they enter, and
Yep.
then you do a measurement for an outcome. And so what's been the success rate? I mean, so, and how are you measuring that success
Yeah,
rate?
well, it's just been for about 2 months that we've really been able to get children into the developmental intervention services. And so that's, right now, we're most of them are getting their baseline evaluation.
So with this program, you're only 2 months in. I mean, there's not any empirical data that's based
Right,
on the
right.
continuing funding
Yeah.
that you've done.
I can tell you with the research that we have with our Pearl Nelson Center, which is those children who qualify for Early Steps, what we have at the point of discharge, where they say that 1 out of 3 should not need special education, ours has typically been about 52% of our children at the point of discharge are being discharged because they've met all their goals, are no longer showing developmental needs, or no longer scoring eligible for the services. And so we don't have a data system in our community that follows them to kindergarten at that point, which I would really love to eventually have. That's one of my lifetime long-term goals.
Exactly. Well, I mean, and that's probably to my point of if we do this intervention at this age, I mean, how are we case managing it, and how are we knowing that there is an ROI on the dollars that we're presenting? And so how do we follow and do this intervention and say, whether it's a collaboration with the school district, early learning, Head Start, I mean, how are we measuring it to make sure
one
that
of my
it works?
concerns, we always talk about birth to 3 being the primary, and that is the primary focus. One of my concerns for this is, okay, these services stop at 3, and so we've got from 3 to 5 before they get into kindergarten. So what are they going to lose that we've already built for them during that time period?
Yeah, just I mean, I was part of United Way Success by 6, and I get it. I mean, my last question, and then I'll end because
Yes, sir.
I'm sick and I'm late. So what is the caseload of these employees, I mean, that we're funding?
So they will, the developmental interventionists will have the equivalent of like 20 sessions a week on their caseloads, and they work 40 hours a week.
And
so there's that travel.
how many units would that be?
That will,
How many
unit
kids, how many
meaning-
people will be, how many children would be on that caseload?
So that could be 20, or that could be 30, depending on the frequency that we find that the children are needing.
But we measure that and we report that.
Yes.
And then-
Yeah, we have Help Me Grow has a data system called System for Tracking Access to Referrals, and it is very comprehensive. It tracks things from every angle you can think of.
And my final question, Madam Chair. And so once they graduate from your program, how are we monitoring them and measuring them once they fulfill
That's
this
an answer
program?
our community has to look into further. We don't have a system that does that.
So for me, I mean, I would look for that collaboration because at the end of the day,
Yeah.
the community is paying for this.
You and I together,
So-
let's get it done.
Yeah, we got to get, I mean, we can't pay for it on the front end. I mean, all kids are cute when they play T-ball. I mean, the problem is when they get ready to go to high school.
Right.
Yeah. Thank you, Madam Chair.
Thank you.
Thank you. So we are moving on. Great questions, by the way, and I agree. Maybe we can find somewhere that can pick up those pieces. That 3 to 5 is also important.
Yeah, I mean, we got to get on. We can't just invest money on the front end and say we don't know what happens to a kid once they finish this program. I mean, that's like you put them through kindergarten and we don't know what happens in the elementary. You put them in elementary, we don't know what happens in middle school. I mean, that's not a great investment. You know, and would be something difficult for me to support if we don't have that case management follow-up.
So we are, maybe that's something we can talk about at our programs committee meeting. I like that. We're going to add that to the agenda.
Yeah, exactly. Not tonight. You got to get to a baseball game.
Yes.
And I got to get to basketball, so we're good.
Yes. So we are moving on. So we've done the job description. Ms. Abrams with the budget amendments.
Yes, thank you. So I went through and was evaluating line item by line item all of our expenses and revenues. And we're at about 67% of our time remaining, so I was expecting to see that amount remaining in each expense line item. In areas where I did not find that, I went and did an evaluation to see if it was a front-loaded expense, we paid for most of it already up front, or if it's going to be ongoing. And in the expenses where I found they were going to be ongoing, I went and I made what I recommend as adjustments. So if you look at the Statement of Revenue Expenditures page, you're going to see in our interest income, we're earning a lot more interest than I anticipated, so I'm projecting to increase that by about $250,000. We're making about $98,000 to $100,000 a month in interest right now. So, and then our bank fees have also been higher than expected. So we're paying $700 to $900 a month, which is more than the $600 I had budgeted for earlier. So I'm looking at increasing those. There's some other line items in our total expenses. I offset everything that I was looking at in our operating expenses. I was able to offset increases with decreases other places. So the only place I'm looking at totally increasing expenses overall is taking that $250,000 from revenue and increasing our grants to outside agencies by that $250,000. All of the other expenses I was able to offset. I offset our May overage of $16,525 expenses out of training external, which is where we had budgeted money for our Children's Summit. But we do not think we're going to have a Children's Summit this year. And at the workshop, we'll talk about where we think we could do with that money. So overall, it increases our budget by $250,000. I don't know if anybody has any questions.
Any questions? No questions. Can I get a motion to approve the budget amendments?
So moved.
Second.
Any discussion? All in favor?
Aye.
Aye.
Any opposed? Amendments passed. Our last recommendation is regarding cell phones for the staff. Ms. Cannon, would you please give us some background information, followed by the recommendation?
Well, I'm following up on where this was left off with the previous executive director in discussion with the board. There are some real significant reasons that we do need cell phones for the staff that we discussed, of course, during our finance committee and personnel committees. This is a legal record, our cell phones. We should be conducting business for the trust on cell phones only that belong to the trust. If that person leaves, they take all of that with them on their personal phone. We need to be able to back into that. So I view that as a legal record for us that someone could request. So we need to go ahead and have it, first of all, for that, but also that's part of, being accountable for our time as well as staff. So I know that it was approved before. I had when I came back on, was able to kind of work with Ms. Alma on that to pull 3 quotes. They were T-Mobile, Verizon, and AT&T. AT&T was out of sight. T-Mobile does not have great service north of 9 Mile Road, and we need to be able to serve the whole county and be available. So I think that the committee had said Verizon was the choice, and we would like to move forward with going ahead and doing that. Nobody needs a fancy phone, but we do need to be able to text and answer and probably access the internet. So,
Thank you. May I get a motion to approve Verizon as a carrier for the staff cell phones?
So move.
Second.
Any discussion? With no discussion, all in favor?
Aye.
Any opposed? That passes. Now on to the executive director. She wanted to present something.
see if we can get it to X out of this. Let's see. Michael, I might have closed it out. No, I wanted that slide. Does everyone have it? Sorry. And then the PowerPoint.
Should have it behind this.
Let's see.
Get started. Okay. All right.
Well, I'm going to go ahead and get started. First of all, I want to talk about some of the, I want to kind of break this up into 30 days. So today's 30 days for me. So I'm still standing. And I'm excited to be here. I first want to say this has been an incredible experience. I've been doing a lot of different work for 10 years, and so to come in, this is a great staff. And they have so many wonderful ideas, and they're ready to go, which I love. So what I've been doing the last 30 days, I'm going to give you guys an update and a preview of where we're going with this. Following up on some of those left off things. There were a lot of things that when the previous executive director left that were just in process and just kind of stopped. So we're working through some of that. Some of that has to do with renewals of contracts, looking also at policy and procedure around those sort of things. We don't necessarily have that. We haven't been there yet. We're approaching some of that. So looking at a lot of those, working through the sole source opportunities versus, which would have been like legal services in North Florida coming in as a sole source. We also had Pine Forest with Children's Home Society coming in. We had not done renewals before, something new. So looking at those, and then also looking at our financial position and learning from Tammy. She's been wonderful to say, we have money that we need to invest. So I feel like our workshop that we have coming up is going to be very timely, because we need to spend some time determining the direction we want to go. I've also been looking at policy procedures. That's been a little bit of a challenge, and not necessarily in a bad way. We're just at the beginning of a lot of that, but we have contracts out here and we have policy. Those things have to match. So we're one by one as situations coming up, comparing those things, making a list for legal. I've already told Meredith we've got a lot of work to do around this, but actually spent some time yesterday, about 2 hours, picking apart a contract where the holes were and where our policies match that. So we do have some work to do around that. We want to be fair to our providers, and we also want to be fair to this organization and what we're doing. And then I've been doing some pre-planning also for our board workshop and some of the ideas and things that I've heard from you guys in our one-on-ones. If I haven't had that with you yet, I definitely want to hear your opinion of what we need to be talking about at that meeting. We have also, during this time through operations, executed all of the new out-of-school time renewals. That's been a process. We're going to have to figure that one out, do a lot of back and forth. But we did get those signed off on, with the exception of one, which is the city of Pensacola. That has to go through their board for approval. So that one will be coming up soon. But the rest are all into year 2. Part of this that we're finding out too is with renewals and expectations. We had contract changes. We want to make sure our providers understand what that means and what they are responsible for. So we're going to be having tomorrow morning provider meeting with all of our out of school time folks. Plan on doing that quarterly, but also really going over those contractual responsibilities that we have now put in there, especially regarding data, regarding payment, submission of that, and then meeting outcomes. So we want our people to be successful and prepared, but sometimes we had a contract and we don't always know how it connects. So we're going to be connecting those dots, but also working with them to create their collaboration. They're all doing out of school time. There are some enhancements and some enrichment type of activities. They need to be working together too, especially if someone doesn't have an opening and someone does. We want all of these slots filled for our kids. We'll also be doing that with our mental health RFPs as well. So we're starting with out of school time. We're going to be moving forward with that too, and working with those providers as well. So I've kept Michael busy too, by the way. He's been ready to go. But for communications and outreach, he's been working on our resource guide for this year. So we've gotten all the ads in. He's proofing all the content. So we're looking at that being printed in April and coming out end of April and May for distribution. So we've got a distribution plan. We're going to be following up on that and any other sites that want some of those. We definitely want to follow up with, so we'll be letting our providers know that as well. We're also working on establishing a communication outreach plan for the year, structured newsletters, like what are we going to talk about in advance, but also really working with our providers to learn their success stories and what their needs are too. So spending a lot more time in the field with them and telling their story. Mr. Leonard invited me to podcast. I keep calling it Podcastapalooza, but it's Podcastpalooza. I want y'all to know, he was like, you have to come. I said, okay, I'll be there. I'm leaving the Pinewood Derby, though, and then I will be there immediately. So I asked Michael, I said, do we have any material? And he was like, no. And so he and Rick got together and developed a very quick but starter trifold. But it had all of our providers on it. What I want to tell you is, the really amazing part of that, I was by myself at that event. We had some stress balls and whatever, but the parents that were walking through that environment, they were looking for help. And I will tell you, it gave me the opportunity to give my speech of when someone said, what does the Escambia Children's Trust do? Okay, well, let me share with you. This is where it started. This is where we are. And these are programs that are free for you and your children. There were so many parents that were thankful and grateful, and that was not what I really expected. I really expected just to hand out some things, but they asked a whole lot of questions. And so to be able to say, you need to call these people, here's their phone number, here's their information. You know, they may ask you some qualifying questions, some may not work out for you, but here's a list of where you can go for help. And a lot of them told me, this is why I came here. I came here because I needed help. So great event, superintendent. It really was. I did not stop from 10 to 1, and all my stuff is gone. So it was a great event. I also got the opportunity to kind of like host or MC the Shining Star event, which is our 5th graders in Escambia County. They are nominated by probably the administration at the school, and they wrote these really beautiful things about these kids. They all get a bike, so I was able to kind of MC that and be able to read about the qualities of these students that made them the Shining Star. And it wasn't always their AB students or their gifted kids. These were kids that had grit. These were kids that really worked hard to be a positive example in their school. So I was really honored to be up there and be able to see those kids, and them getting their free bikes was fun. But we got to do a Q&A with them and ask them some really funny questions about their parents, which the parents were horrified because they didn't know what their kids were going to say. But it was really great. I really feel like a lot of those community events are really tying us back to education, which was our ultimate goal with this organization to begin with. We want our kids to be successful. So I was glad to be a part of that. The last thing that I want to show you, and I don't know if I can get it, Alma, now. Escape. Okay. So I know how to work a computer, you guys. I don't know why. Okay, there we go. I'm fairly savvy. However, it's not working for me today. Dr. Northrup, last meeting you said, you know what, we require our providers to put us on all of their marketing. We would like to return that. So what I will tell you is Rick and Michael got to work on this. And so if you look at our website, which really we do need to revamp this, but this is our starter of what we need, is we put in our providers tab on there. So when you click on this, I want to show it to you. It connects to every single provider that we fund and the location. And there's a way to click on all of these and drill down. You can go by the program name, if you've heard a name. You can go by what's in my neighborhood, what type of services you need are all here. But everything that we are doing here at the Trust is on this website and accessible. So you can click on all of these individually if you want, just to see what they are. But I would encourage you guys to go and look at it. We tried to make it fairly user-friendly. There are some things that we probably, need to link up or do whatever, but we really wanted to have a place, because I will tell you, this flyer was impactful, and for people that are not there, for us to be able to say and be ambassadors, go to that website and click on our providers. There are a ton of resources there for you. So that is there. So thank you for the suggestion. We appreciate it.
Lindsay, you told me a story on the phone about a little boy who wanted to do children's course. Can you tell us that story? When you met, did their family want to do children's course?
Yes.
That was
It was a family, and there were kids everywhere, you guys, which was fun. And I was across from the lady with the bunnies and the chickens, so I wasn't like the most exciting booth. The FFA at Beulah is killing it, I will tell you. But there was a lady that came up to me, and she was looking at this, and bless her, she was trying to ask questions about a variety of them, but she said, you guys work with Pensacola Children's Chorus? And I said, yes, they're one of our out-of-school time providers. And she said, my kid has always wanted to do it. I could never
afford it. It's not anything we could ever do as a family. She said, but do you mean he might be able to do this? And I said, he might. So you need to call them because it is an opportunity. And I said, and you need to find out and tell them the Escambia Children's Trust referred you over there to their program. So it was one of those things, you know, as parents, we want our kids to be able to participate in anything that they want to do, and sometimes that just doesn't work out. It just doesn't work out. Tori and I were having this conversation the other day about football. It's expensive. You know, and there's a lot of kids that want to do those kind of things, and parents just can't. So, the unique opportunity, it was cool to have that feedback. So it was a very positive experience for me. So, any questions?
No questions? No comments? And I got a
Sounds like
list of...
very productive 30 days, so welcome and thank you.
Thank you.
And I know we also talked, so I will start sending Michael some, like, community calls that I'm on to try to connect you and share that information, because I sit on a lot of calls with, like, community organizations and other programs that are looking to network and find out about programs to help families. So I'll start sending you those, and if you want to hop on those. Most of them are virtual, so it's easy to be able to, you know, sit on those and just, like, share what we're doing and how, you know, and I think this is great. So I would love some of these from my office as
Yes.
well.
Yes. So we definitely have them. Now that we've got them, we didn't do a huge run of them because we wanted to make sure we liked them first, but we needed some for that day.
Yeah.
So we'll be doing another run of these, but we would love to provide those to anybody that wants them. So, okay.
Thank you.
All right. Thank you, guys.
Ms. Bush, did you have anything for us? Any other comments from the Board of Staff before we adjourn?
Yes, Madam Chair. Kimberly, thank you for your service. I was thinking about at the beginning of this, and it hasn't been easy. You've persevered. There's a lot of meetings and a lot of discussions and moving parts. And through it all, you've kept your grace about you, professionalism, and we appreciate your service. And I wish you the best with your family and your next endeavor as well.
Madam Chair, Kim, I want to say that you and I have served on boards together. Your passion, particularly for the disadvantaged kids and particularly kids of color, Kim, I appreciate it. You've been bold to achieve. You've been bold through the trust, and you've been bold on every board that I've ever served with you. You stood up for the little person, and so I really appreciate it.
Kim, I want to also say thank you. We're going to miss you. I appreciate you from the beginning encouraging me to believe in the trust, and so I'll try to make you proud. Anything else? If not, we are adjourning at 6:22. Yes.
Madam Chair, I just have one thing. On the minutes that were approved, I just want to note that under approval of agenda on page 1, my notes say David Powell. It was actually David Peden that moved to approve the agenda at that meeting, so I'll make that correction.
Thank you. Meeting adjourned at 6:22.